This video is sponsored by the Association of Anaesthetists, A-Line, Health Education Northeast and NEMO.
Dr. Roopa McCrossan is the Locum Consultant at Freeman Hospital and Newcastle upon Tyne Hospitals in Newcastle. She's a chair of Association of Anaesthetists Trainees Committee and also has a very strong interest in less than full-time training, staff well-being, tackling workforce bullying and harassment. Currently, Roopa is working on the bullying campaign Knock It Out, and she's going to talk about bullying and harassment in healthcare. Thank you very much, Roopa.
Thanks very much, Ilma. My name is Roopa McCrossan, and as Ilma said, I'm chair of the Association of Anaesthetists Trainee Committee, but my proper day job is a consultant at the Freeman Hospital in Newcastle. I'm involved with the Association of Anaesthetists and the Royal College in this campaign called #NockItOut, which is looking at reducing bullying, harassment and undermining in healthcare. So I'm going to talk a little bit about bullying. So what is bullying? So it's when a group or individual uses their positional power in a way that leaves a victim feeling angry or powerless. There's a lot of bullying that goes on in healthcare, and it's a really difficult subject to talk about. The one thing that's very, very important is it's actually the perception of the victim that's really, really important here. It doesn't matter what the intention of the perpetrator was. It's all about how the victim perceives that bullying. We're in quite a hierarchical environment within healthcare, and naturally within medicine and nursing there is a hierarchy there. And that means that we're in a situation where bullying becomes slightly more likely when somebody misuses their position of power over somebody else, or indeed shields somebody that's perpetrating bullying. And what's really, really, really important is it's not about what you think is happening, it's what that person perceives your behaviour as. So it's important to remember that fact. So often I get this comes back to me, oh, that doesn't happen in our hospital. It's really not a problem here. We're a lovely department. But we did a bit of research with some anaesthetic trainees with Northumbria University, and we looked at people's experiences of bullying behaviour. And we did a qualitative study, and it's not been published yet, but these are a couple of the quotes, and I just thought they were really powerful, and I wanted to share them with you. So I'm going to read them out now. The surgeon got incredibly angry. He started throwing equipment across the room, screaming at the nurse about the quality of the equipment. He was literally pulling out the equipment and throwing it across the room and saying, "What bleep are you giving me?" And this is another anaesthetic trainee. He picked up the armboard and he threw it across the theatre. He missed the nurse by a couple of inches and it hit the wall. Essentially, he just started screaming and shouting at her, just being really aggressive. I found those quotes really, really shocking, but I also identified with them because I've seen behaviour like that in theatre. And it's just unbelievable that in this day and age that's acceptable, and we need to move towards a place where this absolutely should never happen. It's completely unprofessional behaviour. So how common is bullying, and what does surveys say out there? What's the data out there? So I looked at the NHS staff survey last year, and 24% of staff report bullying or harassment. I mean, that's a huge number of people. I found a survey as well, which is really good by the BNA in 2017, and it looked at doctors. And I know there's other healthcare professionals dialed into this conference, but I think these results are transferable within the other healthcare professionals. They looked at 8,000 doctors, and they found that 20% had been subjected to workplace bullying. 39%, however, identified bullying and harassment and undermining behaviour as happening in their workplace. So it shows that you're much more likely to actually witness bullying than you are to have it happen to you, but it's still a fairly common occurrence. Interestingly, hierarchy often has a role to play, and we are in quite a hierarchical profession. However, in their survey, they found that consultants and trainees were reporting similar rates. And I thought, well, what about the other doctors, like SAS doctors, locally employed doctors? So I found a survey that the GMC did. This was just last year, actually, and it showed that this group of doctors is slightly more vulnerable in that 30% of SAS doctors and 23% of locally employed doctors reported that they'd been bullied, harassed, or undermined at work last year. Really sadly, but perhaps what you might expect, that if you're non-white, lesbian, gay, bi or trans or disabled, you're much more likely to report a higher level of bullying. So what kind of things are we talking about here? So when I looked through those 3 surveys, similar themes came out. And these were the things that the behaviours people were reporting. So rudeness, incivility, belittling and humiliation, and they were actually quite common. And there is a bit of a culture, I think, within our profession about teaching by humiliation. And that's something we really need to move away from because it's just not acceptable. Really sadly, when behaviour was related to a protected characteristic, and one of the protected characteristics was mentioned, race was the most commonly cited factor. So there is still an element of institutional racism. So the BMA survey was quite good because it also asked people, well, why is this happening? Why do you think this is happening? And there are like 8 or 9 different reasons about why people thought this was happening, but I've just picked out the top 4 here for you to have a look at, because I think they're all things that we identify. 64% of people said that actually the system is just under incredible pressure and we're all really, really stressed. And when we are stressed, that's when bad behaviours come out. And I think it's really, really important at the moment that we are aware of these issues. We're in the middle of a global pandemic and work is incredibly stressful. 62% said they felt it difficult to challenge behaviour, and that was due to hierarchy. And again, with the point that it's because they were frightened, they were scared to speak up. And to go along with that, they said, well, you know, I'm scared to speak up, but also my colleagues don't speak up when they witness bullying. This made me think about how we want to try and create a culture where people feel psychologically safe, because you need to be able to speak out about this. Otherwise, we aren't going to be able to change it. So what are the effects of bullying? Why is it important? This is some work from Civility Saves Lives, and they showed that just witnessing incivility, so just seeing it, not even you being the person that's being bullied, has a massive impact on your performance. So your work performance decreases by 20% just if you witness somebody else being rude to someone else. Also, there's a 50% decrease in the willingness to help others. So just someone being rude has a massive effect on the team all around them. And because I'm an anaesthetist, I found this little survey here, which you can see in the infographic, which is really interesting. So they simulated an operative crisis. So absolute chaos and bitter, someone's dying. And they did it twice, but they did it with a polite surgeon and with a rude surgeon. And then they looked at the anaesthetist performance. And this kind of demonstrates what I've just been talking about. When the surgeon was polite, 91% of anaesthetists performed at the expected level. So what happens when you put a rude surgeon in there? Performance drops massively to 63%. So that was pretty statistically significant. But this was just a simulated operative crisis. What about in real life? What about when it's somebody's life on the line? It's really, really important that we all behave well and are kind to each other. It has a massive impact on patient care. So what are the other effects of bullying? And this again comes from some of the work I've done with Northumbria, and I think it tells its own story about how it makes you feel. I got home and I just cried. Didn't want to go back there because it's a horrible place and I felt so uncomfortable. Another trainee said, I hate it. I really hate it there. She works a certain day that I work, and I booked a good proportion of these days off so I don't have to be there with her. I hate it literally every day I'm in work. I had a lovely day with a different person who was supportive. It's just soured the whole thing now. So you can see that's had quite a profound effect on these trainees. That's just evidence that we've collected, but what's the wider evidence of this? There's been quite a few studies into this, and I've just picked out one here, which shows the effects of being exposed to bullying, so either witnessing it or being bullied yourself, and it's associated with significant problems. So you get mental and physical health problems, burnout, reduced job satisfaction. People start to just not come to work. You see absenteeism increasing. They're not as committed to their organisation. And interestingly, it changes how they think about themselves and their performance. They start to think that actually they're not very good at their job. That's not the case at all. It's just the effect of the bullying. And they're much more likely to leave the organisation, so then you get problems with staff turnover. So other effects, there's a strong association between bullying and the occurrence of adverse safety effects. But this is really, really important that we get this right to make sure we look after our patients. Bullying is a risk to patient safety, and it's a risk that we need to tackle. And that was something that was brought out when you look at all the mid-staffs inquiries and the Francis report. That was one of the main things that came out of that report, was about culture. There's this one study here as well that looked at it in financial terms. And they thought, well, what does bullying cost the NHS? And they looked at sickness absence, employee turnover, diminished productivity, sickness presenteeism, turning up to work when actually you shouldn't, compensation and mitigation, etc. And their cost is enormous. It's £2.28 billion per year. I'm sure we can all think of areas where we can use that money a little bit better. So to try and tackle some of this, I got involved with a campaign with the Association of Anaesthetists and the Royal College of Anaesthetists called #NockItOut. This is a campaign that's aligned with other organisations. So the orthopaedic trainees have Hammer It Out, the surgical trainees have Cut It Out, often value have Push It Out. And all of those campaigns, we're working together because we want to change workplace culture to one that's free of bullying, harassment and undermining behaviours. So what are we doing about it? So as well as doing the research with Northumbria University that we will go on to publish, we've done a couple of infographics, and please download these. Here's the URL. You can go online, they're free to download, print out, put them in your workplace. It's all about trying to talk about this and create a culture where we feel safe. So we've got this infographic called A Safer Space, which just reminds us actually to just behave properly, so speak kindly, be patient. When things are getting stressful, acknowledge it. And we've put a little phrase in there to try and give you some tools to help you do that. So I've noticed this. Is there anything the team can do to help you? Try and facilitate civility. Make sure you engage your team and feel able to raise concerns and do challenge unprofessional behaviour. If you can, resolve it. If you can't, don't be scared to escalate your concerns. So we recognise that sometimes it's really hard, isn't it, to actually do something when you're in the moment, because it's quite frightening. And we did this piece of work where we've used the 4Ds, but we've altered them slightly. So the 4Ds was a concept that was originally put together to do with reducing sexual violence in university settings. But we've used those and adapted them for a healthcare setting to give you some tools to help you if things aren't going so well in theatre or in A&E or wherever you are, to help you take action. So the 4Ds are declare. So don't ignore discourteous behaviour, but try and use non-threatening words to calm everything down. I noticed your stress. What can I do to help you? Distraction is another tactic. So maybe interrupt, try and change the course of that interaction and refocus the team on what they're supposed to be doing. You can always delegate. If you feel you're not in a position to intervene right now, it's okay to ask somebody else. Ask a senior team member to get involved. And there's always delay. You can speak to that person afterwards who isn't appropriate and try and tell them why. And maybe use words like, I think some of our colleagues were upset by your words or your actions. So there's just some little tools there that you can use. And again, that's available at the URL that was on the previous slide. So please print it out and put it up in your department. Yeah, I just wanted to finish to say that we make the culture we work in. And actually, we all have a responsibility here. And when I say we, I mean organisations, I mean trusts, but I also mean you and me and individuals. And how we behave really, really affects the people around us. And if we can start modelling that good behaviour, hopefully that will spread and we will see future change. Thanks very much.